Welcome back to the Arise interview. I'm Charles Aniagolu. Now, health ministers from 15 West African countries have gathered in Abuja for their annual regional meeting. It's a big deal, an auspiciously important event hosted by the Nigerian Minister of Health, and it focuses on the development of policies that improve the health of all ECOWAS citizens. So, against the backdrop of the pandemic and all the dire warnings of vaccine shortages, what are the key priorities this year? And what are the big challenges ahead, not just with COVID, but with other health issues? Well, for more on this, I'm joined now in the studio by Professor Stanley Okolo, Director General of the West African Health Organization, or WAHO, the organization that's at the heart of this all-important meeting of ECOWAS health ministers. Thank you very much indeed for joining us.
Thank you very much, Charles. I'm glad to be here.
So tell us about the main focus of this meeting of ECOWAS health ministers.
The Assembly of Health Ministers of ECOWAS is the singular governance meeting that sets the agenda, reviews the activities for the year, and proposes programs and plans for WAHO to undertake in the coming year. So this is the 2020 review. We are reviewing the 2020 year when we had the pandemic, and unfortunately the meeting had been delayed from, we usually have it about between April and June, but because of some of the activities, that's why it was pushed back. But we are very grateful that Nigeria stepped up to the plate with the short notice, only about 3 to 4 weeks.
Well, that's the least they can do. You are Nigerian yourself.
Well, you know, Nigeria has been supporting me extremely well. Nigeria has supported WAHO, and having appointed me to go and lead WAHO, Nigeria has absolutely not shirked in providing resources that are required. At some point, we were here talking about the cargo plane loads that Nigeria gave us, in terms of cargo planes that Nigeria gave us to distribute, and we distributed nearly 100,000 kilograms of materials to different countries.
Well, I'm glad to hear that Nigeria is doing its bit. As of beyond, of course, you being Nigerian, I mean, it's the big powerhouse in West Africa in any case, so the expectation is that it would do more than everyone else. And this gathering is particularly important because, as you mentioned, it comes against the backdrop of the pandemic as well as vaccine shortages, doesn't it?
You're absolutely correct. And that's why, for the first time in this, in ECOWAS, we now have some parallel meetings today. And so what we did was to invite the heads of the NPHIs. NPHIs, it stands for National Public Health Institute. So like the NCDC in Nigeria, and you have all the national public health institutes of the 15 countries were invited to participate in the meeting, including the heads of vaccinations. So you know, the National Primary Healthcare Development Agency, the counterpart in the other countries, so that we discuss the progress made so far, the preparations for vaccine manufacturing in the region, because we're really pushing on that.
Well, I'm glad you mentioned that, because that's a crucial point. It's almost like you and I had a chat beforehand, because my next question to you was going to be, do you and the ministers discuss how West Africa can actually start manufacturing its own vaccines rather than having the begging bowl out all the time? I mean, you know, 15 countries make up ECOWAS and they can't do it with all their resources pulled together, whereas tiny Cuba, on its own and with punishing sanctions, manages to develop its own vaccine.
Yes, I agree with you. There is also the question of future-proofing and the question of planning before we have the pandemic. That's absolutely correct. But let me just tell you something. Before 2020, there were only 2 countries in Africa that had the collaborative ventures for manufacturing vaccine, Egypt and South Africa. Post-2020, we now have 6 countries, Nigeria included, Senegal. And also we are looking at 4 manufacturing outfits, 1 in Senegal, 1 in Ghana, 2 in Nigeria, that we are now linking on a collaborative venture with vaccine manufacturers abroad. By the way, these ones that we talked about before 2020 are also collaborative ventures. And I'm sure your listeners understand and your viewers understand that the whole process of vaccine manufacture takes a long time. And we have had unprecedented progress and speed with the vaccine manufacturing for COVID. But that's partly because the technology also changed. The first time this was published in the most eminent journal, scientific journal, was 2014, using mRNA to develop vaccines. And so I think what we are planning to do in a strategic way is to start with collaboration on what is called the fill and finish towards the bottom end, and we do that. And then over the medium to long term, we actually look at the research to produce our own vaccines.
In all fairness, of course, I mean, it's not just COVID, is it? I mean, some other person in some other part of the world has developed a vaccine for malaria, which is endemic to this region. But I mean, the reason I mentioned that is that I'm wondering whether this is a kind of a slow car crash with regard to health in West Africa. I know it's putting you on the spot, which is not entirely fair, but that's life. We're not seeing people dying in front of our eyes yet, purely from luck, but it's going to be like that by the time there's another pandemic if we don't do something about it.
No. I'll challenge you on that. And it's not being complacent, but at the same time, let me tell you what we're doing. One of the things you might not realize is that we have invested heavily in terms of supporting manufacturing entities within West Africa because we foresaw this. One of the things that WAHO did, let's even leave the drugs, for example. Let's talk about the diagnostics. Now, today, when the pandemic started, only about 20 months ago, we were scrambling trying to find diagnostic tests with which to test people to see whether they have COVID. Today, we're manufacturing that in West Africa. And that is partly because of the foresight of the manufacturing companies, but WAHO was a basement investor in seeing you haven't manufactured anything yet, but we see your plans, we will support you, we'll link you with people, and we'll give you money. And so Institut Pasteur Dakar has now manufactured RDTs that have been tested and found to be of quality. And we're going to use that for opening our borders, the land borders, so that we can rapidly ramp up. So that's regarding that. Let's talk about the drugs. Now, we have previously seen that probably about 70% of the drugs we require, that we do import them. So the first thing we did was to see how we capacitate manufacturers to come into the region. And they wouldn't come if you have 15 countries, some of 1 million, some of 500,000, 200 million, and they have multiplicity of registration platforms. So we brought the registration of drugs together. And now we've achieved that. We are the second region in Africa to achieve that. Then the third thing that is really important in terms of explaining how this progress is going is for us to realize that actually when you get into talking about manufacturing of drugs or of vaccines, it requires you to first of all think about what is called the API, the active pharmaceutical ingredient. Most of it comes from China. It's got to be something that actually is done on a global scale, on a large commercial scale. And we have been able to convince the African Development Bank to invest in it. And during this meeting that we're having, African Development Bank is coming. The president, unfortunately, can't make it, but the vice president is coming to speak to our ministers about what they're doing regarding promoting vaccine manufacturing in the region. So really things are happening. And then the final thing that WAHO has done is we realized what happened with Ebola. And that's why some of these issues regarding the vaccine coming from outside. Ebola was here 2014 to 16. But do you know what? The tissue, the viral samples went abroad. And therefore, those are the viral samples that people use to manufacture vaccines in the traditional technique. So because of that, we developed or we set up a biobank where now countries can store some of these samples in Cote d'Ivoire. So there are some things that are happening, but it's when all the community of interest come together, then you'll find that these will coalesce to have the major.
Well, I'm glad to hear you saying that and sounding as confident as you are. What happens next with this meeting? We've got about 30 seconds left. What can we expect?
We have the meetings of the health experts. These are the permanent secretaries, directors general for the next 2 days. We also have the meetings of our partners on Wednesday. So we have all the people who support us in WAHO. Right. And then we have the Assembly of Health Ministers on Friday. And this will bring together all the ministers, and we expect from the highest authorities of Nigeria to be the opening the ceremony. Thank you so much.
Director General of the West African Health Organization, Professor Stanley Okolo, thank you very much indeed.
Thank you, Charles.
Always appreciate your presence.